Thanksgiving is 1 week from today, a few days away from today, and that means the start of a holiday season filled with gatherings and travel. It's also the start of a busy season for flu, RSV, and COVID. So how do you keep your household happy and healthy this holiday season? Green Kefa is in Washington with some expert tips.
The TSA already expects that this will be their busiest holiday travel season on record. And by their definition, that starts on Friday. And that means a lot of people packed into crowded places like airports, airplanes, and those stores when you get your holiday shopping going. And there's been a lot of questions right now about cold and flu and vaccines this winter season. So we decided to ask the director of the CDC for some answers.
Thanksgiving kicks off the bustling holiday season filled with fun, friends, family, and the potential for viruses. Dr. Mandy Cohen, director of the Centers for Disease Control and Prevention, says it takes time after a flu, COVID, or RSV vaccine to build up maximum protection. So the sooner you get a shot, the better.
It does take about 2 weeks for your body to build up the maximum amount of antibodies, but it's never too late. Right behind Thanksgiving, we know we get right into the rest of the holiday season, and we want to be protected again as we're going to holiday parties, we're getting into Christmas and New Year's.
The CDC recommends that everyone ages 6 months and older get a flu vaccine this fall and an updated COVID-19 vaccine, even if you had one last year.
That virus has changed, and the protection you've gotten from past infection or from getting the COVID vaccine has decreased.
Adults over 60 and parents of infants should talk to doctors about whether an RSV vaccine is appropriate for themselves or their little ones. And Cohen says there are easy steps to protect against picking up infections in crowded places like airports and malls.
Masks do work to protect you from the viruses that are circulating. Of course, wash your hands, bring some hand sanitizer with you, and if you have the opportunity, open a window and go to places where there's more ventilation.
And if you're sick, stay home. It's a season for spreading joy, not germs.
In addition to vaccines, the CDC also says don't forget about the basics this holiday season. Good eating, sleeping, and exercise habits can also help to keep you healthy. In Washington, I'm Karen Kefa.
Thank you, Karen. Now, in a health watch, the Sangamon County Health Department is receiving doses of the RSV vaccine for adults. It's a new vaccine for adults, and they're uncertain of the demand for the vaccine, but they do have a limited supply of the vaccines available. Meanwhile, hospitals have been handling the distribution of the vaccines for children.
The children, I think, are being handled in the pediatrician's office very well. And so if we have some demand here for the kids, we can certainly make those referrals.
Officials say they plan to open up appointments for adults in the future. And the CDC is releasing 77,000 additional doses of an RSV shot for children amid an ongoing shortage. It comes as infections surge in parts of the country. Bayfortis is meant to protect babies from severe cases of RSV infections, but demand has outpaced supply. Last month, the CDC asked doctors to prioritize doses for infants at the highest risk.